Welcome everyone to this afternoon's session on workers' compensation policy implementation. So there's 3 presenters. Each of us have 15 minutes to talk, or 14, we can do it. And then we'll aim for 5 minutes of questions each. And we'll start off with Anya Keefe, who's going to talk about the Newfoundland and Labrador dialogue on return to work.
So good afternoon, everyone. It's a pleasure to be here to speak to you about the Newfoundland and Labrador dialogue on return to work. It was a multi-phased, multi-stakeholder mechanism for knowledge exchange and for identifying areas for future research on return to work in Newfoundland. The dialogue was co-sponsored by the Policy and Practice in Return to Work Partnership, based here at the University of Ottawa, and by Memorial University's Safety Net Center for Health and Safety Research. So I'm going to start with just a little bit of context about Newfoundland and Labrador to highlight why it was important to undertake the dialogue. Yay, technology works. So the province has a population of just over 538,000 people. Approximately 86% are working age population, and of these, nearly half are aged 55 years or older. Over the last 50 years, the province's population has aged much more rapidly than in any other province in the country. This aging phenomenon is exacerbated by low fertility rates and high rates of outmigration among young people in the most fertile childbearing age range. About a third of the population are recent immigrants, and just under 10% are Indigenous. The province has a labor force participation rate of about 51%, and as you can see, the labor force is dominated by jobs in the services producing sector, which includes healthcare and social assistance and retail trade. In recent years, some sectors have increasingly relied on temporary foreign workers to meet their labor needs. According to Statistics Canada, there are 19,002 businesses with employees, and nearly 90% of which employ fewer than 20 workers. There we go. Like all provinces and territories in Canada, return to work programs in Newfoundland and Labrador are delivered by the Provincial Workers' Compensation Authority. Provisions governing return to work are found in the Workplace Health, Safety and Compensation Act and are interpreted in policies and procedures. At the time of the project, Newfoundland and Labrador had 19 policies and 14 procedures on return to work. That was the most of all jurisdictions that we scanned in the project. They've recently revised and consolidated some of the policies and procedures, and at present, there are 14 policies and 12 procedures. So briefly, the Act sets out the duties and obligations imposed on the workplace parties, as well as Workplace Newfoundland's responsibilities regarding certain aspects of return to work program delivery. The policies interpret the provisions in the Act and clarify the roles of the parties, the reemployment obligation, and how certain aspects of return to work are operationalized, like, for example, the factors to be considered when evaluating an employer's claim of undue hardship, which, if allowed, exempts them from their statutory duty to accommodate injured workers returning to work. So turning now to the dialogue. The dialogue started from the premise that while all might agree that early and safe return to work and labor market reentry programs are good for workers and employers and for the compensation system, attention needs to be paid to when and under what conditions they are most effective. In particular, consideration needs to be given to the types of workplaces and to different groups of workers across diverse industrial sectors and types of injuries and illnesses. These factors have consistently been shown to influence when return to work is likely to be safe and effective in terms of protecting the physical and mental health and income of injured workers. And the 4 overall goals and objectives are shown on the slide, and I won't read them aloud. So, as I've already mentioned, the dialogue was structured as a multi-stakeholder and multi-phase dialogue, and it consisted of 4 2-hour virtual sessions in the fall of 2022 and the winter and spring of 2023. The first session introduced the larger Policy and Practice and Return to Work project and kicked off the dialogue with presentations that highlighted the complexity and some of the challenges of return to work after work-related injury and illness. The second session focused on the challenges of implementing return to work in particular types of work situations, some of which are becoming more common in Newfoundland and Labrador, and in the context of Newfoundland and Labrador. The third session shifted the focus to other factors that might influence return to work and its outcomes for injured or ill workers. So specifically, the legislation, regulations, policies, and procedures that govern how return to work is managed in Newfoundland and Labrador and some other Canadian provinces. The fourth and final session wrapped up the dialogue and provided an opportunity for participants to reflect on what they had learned and to brainstorm some next steps. So researchers in the first session presented findings on the processes that influence the success of return to work programs generally, for immigrant workers and for workers with musculoskeletal or mental health conditions. Researchers in the second session presented findings from studies of return to work in small businesses and among precariously employed workers, mobile workers such as interprovincial construction workers and seafarers working in the maritime industry, and also workers with particular vulnerabilities, specifically those employed under the Temporary Foreign Workers Program in agriculture and other sectors. So some key takeaways from this part of the dialogue were that return to work is complex and challenging, particularly in non-standard workplaces like small businesses and in non-standard work relationships such as those experienced by gig workers, temporary foreign workers, and interprovincially mobile workers. Across the various topics, several common themes emerged, including workers experiencing barriers to accessing healthcare, workers falling through the gaps of multiple return to work policy frameworks, a lack of clarity around who is responsible for recovery of interprovincially mobile workers or temporary foreign workers, and the difficulty of finding suitable modified work and accommodating injured workers returning to work. So one of the other key takeaways was that the evidence indicates that what works best to sustainably return an injured or ill worker to work are multidisciplinary, well-coordinated, and personalized approaches tailored to the individual worker, and that workplace-based return-to-work programs are effective when they incorporate two of the three elements shown on the slide. So the provision of health services at work or in settings linked to work, return-to-work coordination, and work modification. However, successful return to work can be impeded by a variety of challenges, including barriers to access to healthcare services and the quality of those services that vary across types of work and workers. Also problematic internal workplace dynamics and challenges around access to training and other services that can delay return to work. In the area of work modifications, potential barriers tend to be greater for older workers within small workplaces and in certain types of industries such as remote work and offshore work, where workplace demands may be dynamic and dependent on external factors such as the weather. All of these are relevant to the Newfoundland and Labrador context. So I'm going to move now from research to policy and talk a bit about what happened in the third session. The third session was organized around 5 key questions, and they're shown on the slide. It also included a presentation that compared certain aspects of the legislative and policy context for return to work in Newfoundland and Labrador to Ontario and British Columbia. All of those provinces have a similar focus on early and safe return to work. We also had a panel discussion of the findings, and that was then followed by an open discussion and dialogue with the session's participants. So some key takeaways from this part of the dialogue. The first is that in Newfoundland and Labrador, as in the rest of Canada, provisions governing return to work are principally found in 3 legal frameworks: workers' compensation, occupational health and safety, and human rights. And in addition to these 3 frameworks, in some jurisdictions, there are legal and policy provisions that protect temporary foreign workers, and those provisions have some implications for return to work. And you'll notice in the little note at the bottom that Newfoundland and Labrador is not included in those provinces. The other thing that came out of this session was that the legislative and policy context for return to work generally and for early and safe return to work specifically is complex. Although the overarching goal of return to work is essentially the same in the provinces that we looked at, no jurisdiction has defined in legislation or policy what is meant by early and safe return to work. Across Canada, the legislative, policy, and practice provisions appear to have been developed for standard workplaces, standard work relationships, and physical injuries or illnesses. And with the exception of the construction sector in Newfoundland and Labrador, the legislation and policies do not explicitly address non-standard workplaces or non-standard work relationships. And importantly, the obligation for an employer to re-employ an injured worker does not apply to an employer who regularly employs fewer than 20 workers. And as I mentioned at the outset, with 90% of the workplaces or businesses with employees having fewer than 20 workers, that means that that obligation doesn't apply to nearly 90% of the businesses. So next, I'm going to just briefly highlight some of what we heard from the stakeholders who participated in the project. So I'm not going to go and read every single point. I'm just going to pull out some of the common themes. Across the workplace parties, issues related to access to healthcare and healthcare providers, as well as the assessment of functional abilities, were common themes. So, for example, Workplace Newfoundland highlighted the challenges created by healthcare system constraints. And some of those that they highlighted were that the healthcare system is busy, it's almost non-existent for many rural people, individual physicians are busy and there's no time to complete the reports that are required under the return to work programs. Physicians lack training in assessing functionality and they are reliant on patient subjective reporting. And also that they have some discomfort in being in a gatekeeper position. We also heard from labor representatives who flagged that these barriers to access create disincentives to filing a claim and getting a functional assessment. Management representatives brought up the importance of physicians being made aware when companies have implemented early and safe return to work programs and that they need to provide full information on abilities. Workplace Newfoundland also emphasized the importance of educating healthcare professionals as well as employers. And the human rights representative observed that human rights complaints often get bogged down in the need for medical information. The last point I'm going to make, because I don't have time to go through every one, is I just wanted to draw your attention to one of the points that was made by the human rights representative. And that is that the failure to accommodate workers, or employees at work, is the top issue that they deal with at human rights commissions in Newfoundland and across the country. They also noted that the most challenging cases are the precariously employed, foreign and racialized workers, and those with mental illness. And what we learned in the policy scan is that no jurisdiction in Canada currently has policies that addresses return to work in these populations. So what came out of the dialogue was kind of this understanding that it was absolutely essential to know what works in return to work and for whom, as well as how Newfoundland and Labrador compares to other jurisdictions. The province's lack of a linked administrative database, which would allow for linkage and analysis of data sets like healthcare utilization, workers' compensation, and other data, as well as a lack of occupational health clinics, they were identified as critical gaps for us effectively assessing early and safe return to work in Newfoundland and Labrador. And the former would allow for deeper and independent analysis of return to work that captures those compensated for their injuries, those who are not, and would make it possible to track the trajectories of workers once they were off compensation. And the latter, an occupational health clinic, might help improve access to healthcare services, the effectiveness of early and safe return to work policies and programs, and also offer surveillance potential around assessing what works and what doesn't in different contexts. And one of the key outcomes was that all the stakeholders who participated expressed an appetite for more dialogue. So, wrapping up, there were three key takeaways that emerged from the dialogue. The first was that return to work is complex and challenging, particularly in non-standard workplaces and non-standard work relationships. This is particularly relevant for Newfoundland and Labrador because of the growing number of small businesses in the province, the high rates of seasonal and precarious employment, its status as a labor exporting region, and recent increases in reliance on international labor in migrants with temporary work permits. Secondly, there are a number of work and non-work factors that can either facilitate or impede early and safe return to work. And one barrier that was particularly relevant for Newfoundland and Labrador is the current labor shortage and turnover in healthcare. Although the Workplace Newfoundland policy framework for early and safe return to work addresses and incorporates some of the key facilitators for return to work, the lack of access to healthcare and other services was identified as a critical barrier to successful return to work in the province. And then finally, there are still gaps in our understanding of what works and for whom it works and why it works in Newfoundland and elsewhere. And this was particularly relevant for Newfoundland and Labrador because the policy suite is relatively new, and that creates an opportunity to evaluate how well they're working in comparison to other jurisdictions and how effective they are at sustainably returning workers to work. And I've got an acknowledgement slide. And then the last slide, I've included a link. Will you guys be making the slides available? Okay, so the final report and also videos of each of the 4 sessions is available on the Memorial University website. So with that, I'll take some questions.
Now it's working.
Questions, comments?
Barb.
Yeah.
Barb knows nothing about Newfoundland. Yeah.
Or nothing about this project.
Yeah, so the rationale for the project in some ways was that we knew that there had been virtually no research done in Newfoundland and Labrador on return to work. And because of this partnership and other work that we've been engaged with, we knew that there was a large literature on temporary foreign workers and precariously employed workers and so on that was available in other parts of the country that was not getting transferred into the Newfoundland and Labrador context. And yet, but the Workplace NL operates on the assumption that its system is working very well, as far as I can tell. And so we really were trying to do a kind of knowledge mobilization and push on them to listen to the evidence, be aware of the evidence, and to look critically at their own policy, but also to actually create the mechanisms that would allow for systematic evaluation of its effectiveness and for whom it's working and for whom it's not working in that context, and to prepare for this rapidly expanding population of temporary foreign workers in a region basically that's based on labor exporting historically.
Question? Okay. Oh, okay, we have time for one more question.
Yeah, thank you so much. And I'm wondering really about the underlying issues when we look at return to work and what is motivating the behavior of the various parties and how committed the policymakers are in terms of sustainable return to work as opposed to first return to work. I'll stop there.
I'm actually not sure that I can respond to that. Barb, do you have anything you want to say? What I will say is that one of the pieces of feedback that we got when we kind of opened up conversation at that 3rd session was that Workplace Newfoundland seemed very pleased that they had a comprehensive framework. But they did recognize that there were some issues with it. I did also get the sense that there was some appetite for an openness to, kind of evaluating and modifying as necessary. They were particularly interested in some of the work that I had done when I worked at WorkSafe around getting WCB data into the administrative link database in BC. So they were interested in that and curious about how they might move that forward. Did I answer your question? A little?
Well, thank you very much, Anya.
Thank you.
And can I just ask one final question? Are you planning to publish what you just presented?
Yes,
Good.
we are going to be publishing in the New Solutions.
Oh, fantastic.
Journal. Yes.
Fantastic. It looks really interesting.